Hi, I'm Dr. Seiler from Seiler Skin in Birmingham, Alabama, and we're going to shoot a couple of videos today of the liquid facelift. There's multiple videos of this on our website. This is a patient that's not had it done before. She's had a little bit of filler around her mouth in the past, but never had her cheeks treated. So we're going to use some voluma in the cheeks. I'm also going to use my new tool called the AccuVein that helps me see little vessels on the skin that I can avoid so that it minimizes the risk of bruising. And this patient's actually doing this without any numbing, so you can see how easily she'll tolerate it. We just do a little bit of ice before. We can do a numbing shot if we need to, but she doesn't really want it. So we're going to start injecting the cheeks with a little bit of voluma here. I'm going to let my lovely assistant Lindsay here help me with the AccuVein so we can see if there's anything on the cheek. All right, let's take a look here. So this helps me see if there's any vessels on the cheek, which she really doesn't have many. Alright, that's good. So what we're going to do is we're going to give her a little bit of volume here in the cheek, a little stick. And she's had this done before around the mouth, but she's never had her cheeks done before. She's actually really got good cheeks to start with. Is that uncomfortable?
Mm-mm.
So we put just a little bit of filler in little sections here to kind of just increase the oval of the cheek. Give a little bit of a lift, and you see that because we're using this AccuVein, I didn't make her bleed at all with that. Alright, let's look again real quick. Okay. It's a cool little tool that I bought about 6 months ago that helps me see all the little bitty blood vessels that you can't really see with the naked eye, so that it minimizes the risk of me hitting anything that bleeds. Most patients can do this now without any bruising at all, even though we inject all through the cheek and around the mouth. We're going to do a little bit in her lip too. So we're going to video this just a little bit longer, and then I'll finish her cheeks. And then we'll shoot a separate video of putting a little bit of Juvederm in what we call the nasolabial folds and a little bit in her lip. So just wanted to show how easy this is to do. Most people are afraid of filler because they've heard horror stories about it making them look funny or hurting like anything or making them bruise, and all three of those are generally not really necessary if the injector is good and we take the proper precautions. So you can see that you can't see any bleeding at all, and we've already done a couple little sticks here. Let's look again right there. Okay. The little AccuVein is a great tool to help me know where all the blood supply is so I don't hit anything that will make her bleed. And even if they do bleed a little bit, as long as you hold pressure, they shouldn't bruise. Most people that bruise are going to bruise because the injector does it too quickly. It doesn't take the time to hold pressure or ice afterward, and the patient, will have some bruising. And even if they do have a little bit of bruise afterward, we always tell people they can come back the next day and I can hit it with the IPL, the pulse light that I have that makes the bruise go away, usually in 24 hours. So. Alright, thanks for watching. Stay tuned and we'll shoot a video here in a minute about filler around the mouth.